Up to this point, we've been thinking really a lot about the anatomy of the cardiovascular system, but we're going to start diving into just a few of the really significant aspects of the physiology of the heart. Let's start by reminding you of something called the cardiac cycle. The cardiac cycle is one complete contraction and relaxation of all four chambers of the heart. That's technically its definition, right? I want to remind you again that contraction of a chamber of the heart is known as systole. I know it looks like it just says systole, but believe me, it's pronounced systole. And relaxation of a chamber of the heart is known as diastole. It is correct to say atrial systole, ventricular systole. However, whenever you're reading in a textbook or speaking to someone and they simply say something like, during systole, this happens, they mean ventricular systole, okay? So if it's not specified atrial systole, it doesn't say at all, it's systole or diastole of the ventricle. So the cardiac cycle is this. Both of the atriums contract, then the ventricles contract, then there's a moment of rest. Atrial systole, ventricular systole, a moment of rest, right? That's the cardiac cycle. That moment of rest is known as the quiescent period. And that quiescent period, that is the only chance that your heart has to rest. And keep in mind, your heart is doing this every second that you're alive. Look, if you just had a heart rate of 60 beats per minute, and most of us have a heart rate faster than that, then your heart is doing this whole thing one time every second or more for your entire life. Actually, longer than your entire life because your heart starts beating before you're even born, right? Pretty incredible. And in order to do that, it needs a lot of blood because it needs a lot of glucose and it needs a lot of oxygen. Actually, the heart muscle works pretty well, allowing its mitochondria to burn fatty acids, but that's another story. So since the heart needs so much blood and it's doing all this work, the heart actually makes sure that out of all of the blood pressure that it can generate, it gets it first. The coronary circulation is how your heart gets the blood it needs. You know, it's funny to think of it, but like this entire heart is filled with blood, and a lot of that blood has got plenty of oxygen on it. And yet all of the oxygen that's on the blood in the chambers of the heart, not going to be able to keep the heart alive. The heart needs its own distribution. It needs its own little arteries, bringing blood to its own little capillaries and dropping off oxygen. And that circulation starts with the coronary arteries that are going to branch right off of the ascending aorta. So the aorta is right here, right? It's that little candy cane looking thing. And the aorta, right where the aortic valve is, that aortic valve, when it opens up, it actually covers up the origins of the coronary arteries. And then when the aortic valve closes, the blood goes rushing backwards a little bit, and then blood goes pulsing down into the coronary arteries. Coronary arteries do have a branching appearance like most arteries do. One artery branches into smaller ones, branches into smaller ones. However, they do something that's called anastomoses. Anastomoses are the different connections between the different branches. The way a tree grows is the way most of your arteries are. But coronary arteries are different. That would be as if the tree branches did this, and then periodically some of them went back and reconnected farther on up the limb, right? Anastomoses means that any given little chunk of your heart muscle is usually receiving blood and oxygen from more than one coronary artery. Okay? The coronary capillaries are way too small to be seen, but are very important. And coronary veins, they're collecting up the blood that has given away its oxygen, picked up the trash, the carbon dioxide, and now is that darker color, that bluish color, and heading back towards the heart. Let's have a look. Right? Now, for reasons that I don't know, we usually call the arteries of the heart coronary and the veins of the heart cardiac. Anatomy people, I don't know, okay? But the arteries are called coronary and the veins are called cardiac. The coronary arteries, you can see that the pulmonary trunk's been cut away here so that you can see that the left coronary artery is coming right here. It kind of comes right behind the pulmonary trunk and ducts right under the left auricle. And it's going to very quickly branch. The right coronary artery is coming here. It also kind of ducts under the right auricle. And those are the red blood vessels that are taking blood down the front of your heart. You know, the little groove areas where our coronary arteries and cardiac veins are found, there's a lot of fat all around those. That is not the fat that damages your heart. The fat that's found in those grooves is actually very normal. It'll be found even in the healthiest of people. And that's just fat that's there to protect the heart from trauma. Let's see, do I have a picture of the back of the heart? No. Okay. Remember the coronary sinus, though. This is on the back of the heart, the coronary sinus, and that's an area that gathers up all of the blood, that's used blood coming back from the muscle of the heart, from the myocardium, and it's going to drop that blood off into the right atrium. Oh, that means that the right atrium receives blood from 3 different places: the superior vena cava, the inferior vena cava, and the coronary sinus. Now, this is an unusual image, so bear with me while I orient you towards it. This is as if there is a giant that's laying on their stomach on your computer screen, and their head is where you are, and their feet are on the other side of the computer screen, right? So that's what we're looking at. And here, they have sort of magically cut away the atria. So the left atrium's just gone. If you were right here, you'd be looking down into the left ventricle, so that's your mitral valve. Over here, you are standing in the right atrium looking down into the right ventricle. That's your tricuspid valve. That's all swell. That's not really why I'm showing you this image. I'm showing you this image to show you this really clever thing that the coronary arteries have been designed to do. And in order to explain it, let me back up just a moment and address the idea that while muscle tissue is contracting, that is a bad time to try to send blood through the capillaries. Because while muscle is contracting, all of those delicate little capillaries and arterioles, they're being squeezed shut. So it's very hard to get blood to go through capillaries at the moment that muscle is contracting. By the way, that's the reason why just holding your arm up at the side, like if you're trying to hold something up that's really heavy, it's harder to do that than it is to drop it and lift it and drop it and lift it. And the reason why it's harder is because while you're holding it up there, blood can't get through your contracted muscle. Now, keep in mind that heart muscle is contracting most while the ventricles are in systole. So during ventricular systole, that would be a bad moment to try to push blood through all of the coronary arteries and capillaries. So the heart was thinking and said, wouldn't it be swell if we could figure out a way that while we're contracting, blood is not being pushed through the coronary arteries, but when the ventricles relax for their next beat, that's the moment that blood goes through the coronary arteries. Wouldn't that be swell? And that's how the system has been arranged. So when the ventricles contract, blood is going to come here out of the aortic valve. So it's going to be rushing up at us. When it rushes up at us, it opens that valve. And when it opens that valve, it's going to whoosh, it's going to cover up those 2 openings to the coronary arteries. That means while the ventricles are in systole, the opening to the coronary arteries is actually covered by the leaflets from the aortic valve, and so blood is not being pushed through those arteries. When the ventricle relaxes, when it goes into diastole and it's regrouping, then that valve will shut, and the blood that's out here in the aorta, it'll go back it'll kind of do sort of a backflow thing. And that's the moment that the arteries will get a pulse of blood. Here's how you will see it. Here's something that some doctor or some nursing or PA school instructor is going to ask you about. Everywhere in your body, every time the ventricles contract, you get a pulse. As a matter of fact, if I were looking at your retinas right now, I could see the rate of your heartbeat because every time your ventricle contracts, the arteries in your retina will do boof, boof, boof. And they all do it all over your body, all at the same time, everywhere except the coronary arteries. The coronary arteries are like that friend of yours that when everyone else is clapping along with the song, they're doing it exactly on the counterbeat. And the reason is that the openings to the coronary arteries are immediately distal to the aortic valve. They get covered up when the aortic valve opens, and then they are accessible when the aortic valve shuts, so they get a counterbeat. Let me say a little bit more about operation of all of your valves, all right? I know we're looking specifically at one, but let's just talk about all of your valves. All of your valves get pushed open by blood and get pushed closed by blood. All of them, every single valve, right? If we are talking about opening of the tricuspid valve or the mitral valve, those valves open because blood that's sitting in the atrium is under a lot of pressure. And it's like, oh, I'm under so much pressure. And it pushes open the valve. Now, I know that even in this image, the one on the left, it looks like the papillary muscles are pulling open that valve. They're not. Ever, never, doesn't happen. The tricuspid and the mitral valve, they get pushed open when the blood inside of the atria is under more pressure than the blood in the ventricle. And when is blood in the atrium under more pressure than blood in the ventricle? When the atria are in systole. When the atria are in systole, the ventricles are in diastole, because that allows the atria to contract and fill up the receiving ventricles. When the ventricles are in systole, the atria go into diastole, right? So when the ventricles are in diastole, the atria contract and they push the blood into the ventricles, and so that blood pushes open those atrioventricular valves. Good. Now, when the ventricles go into systole, the atria are in diastole, and when the ventricles are in systole, the blood is under more pressure here in the ventricle than it is here in the atrium or here in either of the great arteries. So now the blood wants to go from where it's under a lot of pressure in the ventricles to either of these places. When the blood is under more pressure here than in an atrium, it tries to push backward and it ends up pushing the atrioventricular valve shut. So when the ventricles are in systole, when the ventricles are contracting, they shut the mitral valve and the tricuspid valve. And simultaneously, pressure will rise up in there and it'll get high enough that it will push open the pulmonary valve and the aortic valve. Okay. So, I wanted to say something about the chordae tendineae. I think I'm going to start our next video with that discussion.